Jobs and positions needed. This slide outlines the key positions needed in order to successfully complete this surveillance project. I chose these specific roles because they all have their own responsibilities towards this project and ensure coverage in all areas of the data being collected. The first position needed for this project is the principal investigator. We would need one to oversee the entire project as a whole. They are responsible for following all CDC guidelines and requirements and reporting the case findings of the project to them. They are also responsible for the overall leadership and collaboration of the project. Next, we would need one project manager. They are responsible for the day-to-day operations of the project, and they also supervise the rest of the staff involved, aside from the principal investigator. They ensure deadlines are met and accurate data is collected. Next, we would need 3 clinical specialists in order to cover all grounds of the records that are submitted with children of autism spectrum disorder. They are responsible for reviewing submitted records and ASD cases, and they decipher if the children meet the project requirements. They also provide their expertise to the project when reviewing surveillance data. Next, there needs to be 5 records analysts for the project. They are responsible for reviewing the children's educational and medical records, and they take relevant information from those records that indicate autism spectrum disorder. As this is a huge surveillance project with submissions from families from all over, 5 are needed in order for the project to stay organized and run according to the timeline. There needs to be 2 epidemiologists. They are responsible for taking the confirmed autism spectrum disorder cases, analyzing that data, and producing their reports and findings for the project manager and principal investigator to look over. They also monitor any trends with autism spectrum disorder as well as any disparities. Lastly, there needs to be 2 administrative assistants. They are responsible for helping with documentation of the project and coordinating outside communication with the families, schools, and healthcare providers involved. This slide is the chain of command that is used for the surveillance project. I chose the principal investigator as top of the chain of command because this position acts as the overall leader of the entire surveillance project. They are responsible for the integrity of the project and its findings, and they make all final decisions within the project itself. The project manager would be next. Their job is just as important as they handle day-to-day operations and report how the project is moving along to the principal investigator at the end of each day. They ensure timelines for the project are followed and communication within the other tiers is clear and organized. I put all the other positions on the 3rd tier as they all report to the project manager, but are equal to one another as each contributes their own expertise to help with the project rather than a hierarchy over each other. The 3rd tier is the core of the project in ensuring that the project as a whole is successful. Each individual role has their own responsibilities, as previously stated on the last slide, and those responsibilities are coordinated by the project manager. The clinical specialist ensures relevant autism spectrum disorder cases are being collected and interpreted. The records analyst validates data so that it can reliably be used within the project. The epidemiologists analyze the data collected and identify any patterns and trends with the autism spectrum disorder cases and produce their reports and findings. The administrative assistants help to keep the project running smoothly and assist the other positions in any way they can. They aid in documentation and help with communication to outside sources of the project, and they are just as important as all the other positions.
Greetings, my name is Rosalie Salazar. For our autism surveillance project, I selected 2 positions that I believe work together to provide both analysis and clinical expertise: the epidemiologist and clinical specialist. Although these roles have different responsibilities, they complement one another and are both essential to the success of the program. The epidemiologist is responsible for studying surveillance data to understand how autism spectrum disorder, also known as ASD, affects different populations. By examining trends and patterns within communities, this individual can estimate ASD population and identify changes that may require additional attention. The information they collect helps public health leaders make informed decisions about future program, services, and resource allocation. In other words, they transform raw data into meaningful information that can help improve community health. The clinical specialist focuses on a different but equally important aspect of surveillance. Instead of analyzing popular data, this professional carefully reviews medical and educational records to determine whether children meet the surveillance case definition for ASD. Their expertise helps ensure that every record is evaluated consistently, accurately, and fairly. This consistency is especially important because its reliable surveillance depends on standardized case identification. When these two professions work together, they strengthen the overall quality of surveillance system. The epidemiologist provides a population level perspective by identifying trends and measuring outcomes, while the clinical specialist contributes clinical knowledge that improves the accuracy of case identification. Together, they create a balanced team that supports reliable data collection, high quality surveillance, and evidence based public health decision making. To identify the strongest candidate for the epidemiologist position, the interview questions are designed to evaluate technical knowledge, analytical thinking, communication skills, and the ability to work as part of a multifunction public health team. I will begin with question 1 by asking what motivates the candidate to use population health data to improve outcomes for children with autism spectrum disorder. This opening question provides insight into their passion for public health and their understanding of the purpose behind surveillance. Next, question number 2. I will ask them to describe a situation when they uncover an important pattern or trend that others had missed. This allows the applicant to demonstrate critical thinking and their ability to interpret complex data sets. Since surveillance relies on accurate information, the third question explores methods they use to detect inconsistency, missing information, or potential errors within the large health database. The fourth question focuses on communication, which is a key competency. I will ask the candidate to explain a time when they translated a language that could be understood correctly by people without a background in epidemiology. For the fifth question, I will ask surveillance involves sensitive information. How will they protect confidentiality while maintaining data quality? For the sixth question, I will ask about their experience collaborating with professionals from multiple organizations and the challenges they anticipate when conducting surveillance across diverse communities. The seventh question, what unique strengths they believe they will contribute to this CDC-funded initiative. The eighth question, I will ask to describe a time they had to manage completing deadlines during a project. The ninth question, what systems or methods do they use to stay organized when managing large data sets or surveillance reports? Question number 10, what will they do if they realize they cannot complete and assign tasks within the expected time frame? All these questions help determine whether the applicant possesses both the technical expertise and collaborative mindset needed for this important role. Next, we have the clinical specialist interview questions. The interview questions I will be asking the clinical specialist are intended to evaluate clinical expertise, professional judgment, attention to detail, and the ability to make objective decisions while reviewing autism surveillance records. We will begin with question number 1 by asking Which aspects of working with the individuals within autism spectrum disorder have had the greatest impact on their professional career? This question provides insight into their experience while it allowing them to demonstrate their commitment to serving the population. Question number 2, I will ask the candidate to provide an approach situation where medical or educational documents is incomplete, unclear, or contained conflicting information, and what steps did they take? Questions number 3, since surveillance requires reviewing hundreds of records, what strategies do they use to maintain consistency and accuracy throughout the entire review process? Question number 4, I will ask the applicant to describe a situation where their professional assessment influenced an important decision or outcome. Question number 5, how do they remain current with evolving within ASD diagnostic criteria and evidence-based clinical practices since surveillance standards continue to develop over time? Question number 6, it's a scenario in which two healthcare providers reach different conclusions about the same ASD patient. I will ask, how do they assess the available evidence while remaining fair and unbiased? For question number 7, what qualities do they believe are most important when reviewing developmental and behavioral health records, and how they maintain consistency throughout case evaluations? Question number 8, how will the candidate prioritize their daily tasks when they have multiple patients at work? Question number 9, tell me about a time you had to juggle both administrative work and clinical support. Question number 10, I will ask the candidate if they will work well under stress and it to give me an example. The interview questions about the clinical specialist are intended to evaluate clinical experience, professional judgment, attention to detail, and the ability to make objective decisions while reviewing autism surveillance records. Thank you for your time.
As the principal investigator, my primary responsibility is to create a work environment where every team member feels respected and comfortable sharing ideas. Because this autism surveillance project includes individuals from different professional backgrounds, including clinical specialists, records analysts, epidemiologists, project managers, and administrative assistants, collaboration is essential for success. I would use a collaborative leadership style because it encourages participation and values the expertise of every team member. While the PI has ultimate responsibility for meeting CDC requirements and project goals, important decisions should involve input from the staff who work directly with records and data. To promote openness, I would schedule regular team meetings where staff can discuss progress, identify challenges, and suggest improvements. Creating psychological safety is important because employees should feel comfortable reporting concerns or mistakes without fear of blame. This helps improve data quality and prevents problems from becoming larger issues. I would also ensure that everyone understands their specific responsibilities while emphasizing that each position contributes to the overall mission. Respectful communication, active listening, and transparency from leadership help build trust within the team. In addition, recognizing employee achievements and providing constructive feedback can improve morale and motivation. When employees feel valued and heard, they are more likely to remain engaged and committed to the project's success. In addition to strong leadership, a positive organizational culture is necessary for creating respect and openness within the project. Organizational culture refers to the shared values, behaviors, and expectations that guide how employees interact with one another. I would foster a culture that values inclusion, professionalism, and continuous improvement. Every employee should feel respected regardless of their role. Team members should understand that their work directly contributes to improving knowledge about autism prevalence and supporting public health decision-making. Motivational theory suggests that employees perform better when they feel recognized and supported. For example, Maslow's hierarchy of needs emphasizes belonging and esteem, while Herzberg's motivation theory highlights recognition and achievement as important motivators. I would support these needs by celebrating accomplishments, providing opportunities for professional development, and encouraging employee participation in problem solving. Ethics are especially important in the surveillance project because staff members work with sensitive health information. The team must follow the ethical principles of justice, beneficence, and respect for persons. This means treating data fairly, protecting confidentiality, and ensuring that surveillance activities ultimately benefit the public. If conflicts arise, they should be addressed fairly and respectfully. By combining ethical leadership and employee motivation and a positive culture, the project can maintain high quality work while creating an environment of trust and openness.